Your symptoms before the surgery?
I had lower back pain for almost a decade. My muscles always felt like they were never going to release. They're constantly strained, and it depended on how I would lay or turn, it would increase the pain. But I never had relief, even if I tried to stretch or do any type of physical therapy.
1 to 10, how bad was that pain?
Always an 8, close to a 10 on many days.
That was going on for years, correct?
Yes.
What kind of treatment did you get in that time frame for this problem?
I did physical therapy. Over the years, as I got older, it got worse. So
Yeah.
I did physical therapy. I had shots, the injections. Then I would live with it for a year and a half,
Yeah.
and then when I'd take time out of my busy schedule, I'd go back in and try physical
Yeah.
therapy, and I'd try something else.
What about the leg? Did you have any symptoms in your legs?
Not really.
Not really.
No.
Okay. Now it's important because some of my colleagues say, in a situation like yours, where we knew there are bad discs, but if there is no leg pain, they are telling do not do surgery. That is probably why you have been waiting that long, because most of our colleagues, they don't believe that without the leg pain you should be taken care of. But you are proof that that's not correct.
Yeah.
That we can help you
Yeah.
even if you don't have leg pain. The back pain is legitimate,
Yeah.
and we can do something about that. Now, and this is what I'm going to turn around and show. This is your back. We did a 1-level OLIF minimal invasive transcarbine fusion. When was that surgery?
December 27th, of 2021.
You remember it?
Mm-hmm.
Now, tell me about how did the surgery go?
It was over very quickly.
Yeah.
I don't remember going in the operating room, and before you know it, I was out.
Yeah. Now, the surgery took actually us about half an hour.
Yeah.
You lost about the 3 spoonful of blood. That's all you lost. And now, when did you go home?
The next morning.
Yeah, and you said that it was later in the day, and that what we
Yeah.
tell me. What did you tell me?
I think if we would have had surgery at 8 o'clock, I would have went home that day.
Yeah, you would have, and many of my patients do. In your age group, actually, most of my patients go home same day. Now, this pain has been going on for 10 years. We did a half an hour surgery with 3 spoons of blood loss, and then you could have almost gone home same day. And when did the back pain go away?
It was gone.
Right away?
I stopped using the medication provided
Mm-hmm.
maybe 2.5 weeks later, and the only reason why I was taking it is because it helped me sleep at night, because
Yeah.
my leg hurt more than my back ever did.
Yeah. Well, you got the surgery. You got those screws are big, and you cannot not feel those screws. But generally, how long after surgery were you able to do your basic daily activities?
Like take care of myself.
Yeah,
Right away.
right away. Now this is a CAT scan again, and it shows that almost 4 or 5 months later, bone is growing inside where we did. Bone in the back still working on it, but in the front, where we call interbody, bone is growing, and those screws are almost 2 inch or more. So those are big screws, 4 of them, and a spacer, 2 rods. So how is walking? How is the activity going on?
It's fine.
Just fine. So what number would you give your pain now?
0.
0. Now you asked me a few questions about the activity level. You want to ask them again?
Yeah, I wanted to know when I could start playing old man hockey again.
Old man hockey. And I think that's a hockey without checking and without
Yeah.
too much contact,
You're
right?
correct. Yeah.
Okay. And as well, the answer to that, what was my answer to that? You remember that?
To wait until we're 6 months in, and then to start very short periods to see how my body reacts to it.
Yeah, and I think that is a common sense way of dealing with a situation like that. For anything that has high impact possibility, that first of all, wait at least 6 months or something like that until you have a good strong bone. This is not a daily activity. This is, you're talking about like hockey kind of activity. Now is waiting 6 months, then doing 3 minutes of any activity you think you want to do, take it slow, waiting 3 days. add another 3 minutes, wait another 3 days. And the reason for that is that by going slowly up with the activity, finding out what threshold of your body is. And once you get to 15, 20 minutes, usually people are good, because if you go up slowly, your body actually adjusts, the bone becomes stronger by putting it through a little stress. If you put it through too much stress, the bone that is growing will break. And I have seen people breaking even those screws. That all can happen if you are not careful. Now, you asked me another question. Do you remember what that question was?
If I could run.
Run. So what was my answer?
So same thing as the hockey.
Same thing as a hockey. And if you would have asked, can I go biking? My answer would have been the same. If your question would have been, can I play basketball? My answer would have been the same. Any kind of activity that put our spine at higher level of stress, it's better to wait for a few months and then slowly start it at the lower level and just find out what your threshold is. And the reason for that is because even though you are talking about hockey or somebody about running, somebody about basketball, I'm not really there to see what you exactly do.
Yeah.
You are, and your body is. So what your body says is more important than what I say. And by going slowly up, your body will talk to you through a language that we all understand. It's pain. But the pain may come the next day, not necessarily in the moment you're doing that. So this is a very good outcome. You had this pain for a long time. We did a half-an-hour surgery. The pain is gone. Bone is growing actually ahead of the curve. And we could achieve that because we did this minimal invasive procedure. Even though my colleagues say don't do surgery if only back pain is the only problem, you are proof that they're wrong.
Mm-hmm.
But and I think you have very good question that most of my patients can benefit from by just listening to this. Anything else you want to tell to somebody in your situation that has been going on for years, painful, and not really nothing is helping? What would you do differently if you knew what you know now?
I wouldn't have waited so long.
Yeah. And why did you wait so long?
I have a busy job, and taking the time out to go through the process, because you're going to have to do the injections, you'll have to do the physical therapy, you'll have to do all that, which is fine. But I used to live in the metro area, and it was more difficult to get to places and get it all taken care of. And there's times where you feel like you can live with it, and then it becomes a burden again. So since I moved I live in Bemidji, Minnesota now. Since I moved there, I decided to take care of stuff instead of waiting.
Did you ever talk to another doctor regarding this pain in that 10 years?
Before I committed to the surgery with you, I had one other consultation with a physician in.
Don't have to tell the name of that. What did that physician tell you?
Pretty much was going to do the same thing that you did.
But in a different technique?
Close. He just mentioned that he had robots that did it.
Robots, yes. Yeah, I have a robot and a computer as well. My computer is between my ears, and my robot is attached to my shoulder. And I used to build those robots they use. And in all of our studies, by proper training, the computer between my ears and the robot attached to my shoulder is more accurate, is better. In the time they just bring that robot in and out, I'm done with the surgery. It takes them more time to just set up that things than I need a surgery, and they haven't even started the surgery. And that's come from somebody who in Stanford built those kind of machines. I built those kind of machines. I have a PhD in computer science. So, but what made you decide to go with me and not with the robot?
Oh, I don't know.
I don't know. Okay, fair enough.
Yeah,
Fair enough.
I don't know.
Excellent. Well, thank you so much. I appreciate that.